I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. I'm deeply saddened to announce that last night we had our first death to coronavirus in Orange County. Our thoughts and prayers are with this man, his family, and loved ones. I am here with David Solelas, Deputy Director of a Healthcare Agency, Orange County Health Officer Nicole Quick, Sheriff Don Barnes, and CEO Frank Kim, who will be providing updates and answering questions about the status of coronavirus in Orange County. Thank you.
Good afternoon, I'm Dr. Nicole Quick, County Health Officer. The first topic I'd like to talk about this morning is our first confirmed death of an Orange County resident related to COVID-19. The individual was a male in his 70s with underlying health conditions who was receiving treatment at a local hospital. We extend our heartfelt sympathies to his family and friends and are unable to provide additional details due to patient confidentiality. What I can share this morning is that this serves as a very unfortunate reminder to the community about the importance of staying home and social distancing when leaving the household for essential activities or to work at an essential business. In order to slow the spread of COVID-19 and help protect our most vulnerable neighbors, community members need to know that we expect more cases as more private labs have come online and testing capability, and our surveillance of COVID-19 is increasing. Follow the governor's order. Stay at home and social distance when leaving for essential activities or to work in essential business. We need to work together to help slow the spread of COVID-19 and mitigate its impacts on the most vulnerable and our healthcare system. The second topic I'd like to discuss is testing. There is community transmission of COVID-19 in Orange County, which means that COVID-19 is spreading here. That means the virus cannot be restricted to one location, but we can lessen the severity of its impact on our residents and our healthcare system. We are prioritizing COVID-19 testing based on medical need and how likely the individuals are to develop serious illness from the virus. This will help us ensure that our neighbors who need testing the most, like those who are hospitalized or have underlying health conditions, can get results quickly to help their doctor and HCA guide their treatment. If you develop mild respiratory symptoms, you should not be tested for COVID-19. So what should you do? Care for yourself at home as you would normally do for a mild illness. If you may have been exposed to COVID-19, testing isn't indicated at this time without symptoms like fever, cough, or difficulty breathing. If you need to seek medical care for COVID-19, call your healthcare provider first so precautions can be taken when you arrive. Your doctor will help determine if testing is indicated.
Good afternoon, everyone, and thank you for joining us today. I'm David Solelas, Director of Public Health Services for the OC Healthcare Agency. I'm pleased to announce this afternoon the launch of our redesigned and much improved dedicated COVID website, ochealthinfo.com/novel coronavirus. Visitors to the site will find it now features a responsive design and cleaner look and feel. Starting Friday, we will be posting information about our case counts in different ways. For example, graphs that show our curve over time and case counts by city. We encourage our residents to check this site out daily for updates. Now, let's talk about hospitals and personal protective equipment. I'd like to say that we think, as everyone is aware, there is a shortage of masks, gowns, gloves, and eye protection nationwide. The HCA has distributed over 1 million pieces of PPE from our local stockpile since late January. We are receiving requests daily for PPE from all healthcare provider types. We are actively requesting PPE from the state and trying to procure PPE as well. That said, we are also accepting donations from corporations and businesses that are interested to help us meet this need. For information, call the EOC Public Information Hotline at 714-628-7085. All hospitals are operational, and most have canceled all non-essential services, including elective surgeries. They are actively preparing for a potential surge in patients. As Dr. Quick said, follow the governor's order. Everyone needs to be all in for this to work.
Good afternoon. I'm Frank Kim. I'm the County Executive Officer for the County of Orange. Today I'd like to provide you an update in terms of the status of access to our county beaches. Following a robust discussion at our Board of Supervisors meeting yesterday, I directed our OC Parks Director, Stacy Blackwood, to close the parking lots associated with our county beaches. The reason for this closure is to reduce the congregation that we have seen occurring within our county beach properties. The County of Orange would like to maintain access to our wilderness parks, our regional parks, and our beaches. We encourage residents of Orange County to participate and utilize these facilities, but doing so in a safe manner by observing the social distancing protocol as ordered by the governor and the county health officer. Doing so will allow us to continue making these important community assets available to all residents during this really challenging time. And with that, I'd like to turn this over to Sheriff Dunlap.
Good afternoon. As you may have been made aware, yesterday we had one inmate who tested positive for COVID-19, the coronavirus. Prior to this, we have had in isolation some inmates who had exhibited flu-like symptoms. The first 8 of those tested came back negative. This is the first positive test that we have received. This individual was in isolation prior and continues to be in isolation within our jail. We have about 6 people currently in isolation, and we're waiting for the responses of those tests. That was as of this morning. The individual is a 40-year-old male. He's in for some charges that are felonies. He's been in our custody since June of 2018, and we will continue to address this. I do want to stress that we have been out in front of this as a precautionary measure, implementing strategies as early as late January. We have protocols in place and always have for contagious disease and control. It is our attempt to keep with those precautionary measures. This individual was in a dormitory type housing. The inmates in that dormitory type housing are being quarantined under observation. If they exhibit symptoms, they too will be isolated and treated concurrent or according to CDC guidelines, which our healthcare agency is overseeing. We have taken extreme measures within our jails. Pre-custody screening of individuals and employees entering the jails. We've ceased many of the programs within our jails to stop contact or unnecessary contact to alleviate these issues, and have stopped visiting to keep those from entering our large gathering at our jails to help mitigate the impacts of COVID-19 that they have among the community. That said, this is not something that we wanted to see, but it was something that we were prepared for if it did in fact occur. We have strategies in place, we're following the protocols, and we will keep monitoring those inmates as we move forward. And with that, I believe I'm the last speaker.
Frank, can I ask you a question? And I don't know if it's anything you can answer. We're working on a story to explain to people today about property taxes, how the state says no extensions, no postponements. Are you well versed enough to explain what happens at this point for the average property taxpayer, to explain when they could ask for a penalty cancellation?
I would say in general, those questions probably are best for our county treasurer, but what I can say is that in our discussions, we are aware that the authority to extend property tax deadlines rests with the state of California, not our local board of supervisors. So our treasurer has authority in terms of being able to individually assess and waive penalties and interest. But beyond that, I don't know that I'm the appropriate person to respond.
I know you all were talking in the meeting yesterday about kind of providing more details about the cases. We were talking about cities, we're talking about, are they hospitalized, are they at home with mild, moderate conditions? Is there an update on providing that information?
Yeah, I think I would ask either David Soleus or Dr. Quick to respond to that.
Can I ask you a few questions as well? and then those on the phone, we will go ahead and ask the next question for you on the phone.
So yes, we are looking at trying to provide additional data. So currently, we do provide daily case counts and daily counts of deaths that have occurred. We're currently providing age and sex. Those will continue to be provided. We are looking at adding city counts on a daily basis beginning on Friday, and then also looking at being able to provide really a graphic representation of the curve of new cases to help all of us see how Orange County is doing. Are we escalating? Are we leveling off? Where we're at on the curve? So all of that is scheduled to go live on the website on Friday.
And their conditions, mild, moderate, hospital versus hospitalized?
So with the volume of cases that we currently have, to be able to provide that in real time is really very difficult. We've also been given the changes in how people are cleared after they have been diagnosed COVID positive. We are no longer clearing with laboratory tests. We're following Centers for Disease Control and Prevention guidelines that really work towards looking at symptom resolution. So when somebody's symptoms resolve, they are considered recovered, but we won't know that because it's not done by a laboratory test. So we are working to get as much additional data as possible available to help folks understand and characterize what's going on in Orange County.
How many people on the call for one moment? Anybody on the call have a question? Nick, go ahead and answer your question, Nick.
So two questions. What is the number of N95 masks and ventilators that are needed across Orange County for the expected surge needs, and what the status is on getting those? And then secondly, in the jails, we've seen other counties releasing inmates that understand there's an order now in Orange County. Just want to understand the sheriff farm and how that will be playing out locally in Orange County.
If we can ask the question first about the masks. Nick, can you repeat your question about the masks?
Sure. How many masks are needed? What is the need in terms of masks, the number, and ventilators for first responders, hospitals, across Orange County, and where we're at, the status on getting those?
Yeah, so as far as what was previously stated, there is a shortage of PPE, including N95 masks, nationwide, California as well. As far as the number needed right now, we have been filling requests from hospitals and so forth through our EOC operation. So at this point, I do not have a number right now of outstanding orders, but we are working to fill those.
Okay, is that something you guys can provide programs? We've been asking for a couple days on that. Again, that's something the public is interested in knowing.
Okay. All right, Nick, we've got your next question is for the sheriff. What was your question again?
That's very good.
Okay, thank you.
Yeah, that was coming up on the inmates in light of the order of court.
Thank you.
So the question for the media was the necessity for releasing. Other counties have been releasing inmates early as part of their strategy. It is part of our strategy as well, but the scaled up strategy. We have protocols in place if the need comes up to release, but it's not our first option. What's maybe unique to me and maybe not the case for my peers throughout the state is we have capacity within our jail. We currently have about 1,400 vacancies within our jail. That doesn't mean they're true vacancies. An inmate, for example, may be one person occupying a double cell, so it takes one of those bunks out of place. But we do have a strategy moving forward. Last week, early last week, or late the week before, I did inquire with the court to get in place the order that would allow me to release, if necessary, inmates from my custody. Unfortunately, that order that was issued had contingencies in it that I could not meet. I had to exceed our rated capacity, for example. We're not at our rated capacity because we have space. So without that exceeding capacity, which we wouldn't do, I would not be able to release. Yesterday, we did receive a new court order that is consistent with the Chief Justice's directives that allows me to release sentenced inmates up to 60 days early. We're not at that point yet. We have a protocol in place, and it's a ramp-up protocol. I asked my staff earlier today that if we had to isolate inmates, how many could we accommodate within our current system? And we believe we could accommodate more than 100 within our system based on capacity. That doesn't mean that we still might not have the necessity to create more capacity with our jail system if we start moving that direction. And that 100 is not an absolute. We may have to make measures earlier if we start to see 10, 20, or whatever it might be. My goal is never to release people early. This is a unique circumstance. It's a unique challenge. And in order to best meet that, we have to put everything on the table, forward thinking, getting out ahead of this, and if necessary, release individuals early from our custody. The one differentiation, though, is the court order allows me great latitude for individuals 60 days or less. We intend to marry that with the Chief Justice's guidelines that will follow who may get released, focused on those in our custody who might be at the greatest risk. Those over 65, those with health conditions, we're looking at it reasonably to best meet the needs of the jail community. The one other differentiation that we are experiencing that is the public is not, as we moved into mitigation, we're still in containment within the jail. We're still moving towards containment. The one advantage I have that the community unfortunately does not is I know where every inmate is, every inmate that was with them, employees who may have came in contact, so we know who to isolate our efforts on to see if symptoms or through exposure might exist. That's what's unique about the jail environment. So that's how we can identify these inmates who were in this housing unit, put them into quarantine, look for symptomology with health care, and as necessary, isolate them if they do have the symptoms for COVID-19.
Sheriff, while we have you up there, can you discuss how
We have one more question. Hang on, from the
how your
audience.
deputies are handling the enforcement of these new closures, the parking lots, various places? I know anecdotally I saw some deputies out enforcing parking lot closures today.
Well, they're not, I don't know if they're my deputies, they may be peace officers, but I think we're trying still to get voluntary compliance through education. That order just went into effect today. And as we saw last week when the health order came out to shut down in dining and restaurants, some people were just unaware. So the first effort, of course, is to educate and get voluntary compliance, and we'll do that wherever we can. We hope not to move towards any enforcement actions for those listed establishments that cannot operate in restaurants for in-room dining, bars, health clubs, and such. We're still educating them, and today we've had compliance with those efforts. But specific to the deputy sheriffs and the other members of the organization, they've risen to the occasion. They're doing well. We haven't seen people call in sick. They're coming up to work every day. They're meeting this head on, as I would expect them to do, and we're up for the challenge.
But at these parks and beaches, that's what I was talking about.
Yeah.
You're told not to park there. Is it going to take a ticket to get people not to be there?
To my knowledge, it hasn't taken that. I think we'll see the same response that we saw last week when we educated the public on some of the in-room dining issues, some of the bars that needed to close, and we've gotten compliance. We could scale up if necessary, but we're looking for voluntary compliance. If, for example, we had a restaurant that was absolutely non-compliant and refused to adhere to the health order, there's steps that we can take. They can lose their license as an establishment. They can get a citation. We hope not to get there. We're still expecting and still getting voluntary compliance. And I think that's the most important part of this. Without the compliance of the community in every aspect of the health order, social distancing, hygiene, staying at home if you're sick, not getting in large gatherings, that's the best method, the best approach, and the best strategy to flatten the curve and get out ahead of this. That's what's going to get us beyond this. So I would ask, and I know I speak for my partners in government service, to comply with the asks of the health order. If you're sick, stay home. Wash your hands frequently. If you sneeze in a tissue. Social distancing is key. It's probably the one thing that we're seeing violated most is the social distancing recommendations. Just remember, if you're within arm's reach of another person, you're not outside that social distance requirement, or at least ask that we're making. I hope I answered your question, Vicki.
If we can go ahead to the phone for a question.
Question for the sheriff and also for the county health officer. For Sheriff Barnes, we talked about that one inmate who you said tested positive but was in isolation. Can you give us a little more as far as how long that inmate was in isolation, and is there the possibility that that person did in fact either jail personnel or other inmates? And then my second question is, why does the county feel it's important to release COVID positive, what cities those people live in Orange County?
So Michelle,
Why is that important for the public to know that?
I'm going to summarize, Michelle, your question for the rest of the media. The question, as I heard it, was the individual who tested positively, when were we made aware of that? And I think the second part of your question was the other individuals that they were housed with, how we're treating those. Is that a good summary, Michelle?
Yes, is there
Okay.
the possibility that that inmate spread it to other inmates or jail personnel?
Sure. Okay, so the first question, the individual, and I'm looking for confirmation or affirmation from healthcare in the back, was we were made aware yesterday morning when he was symptomatic. He was isolated. We tested yesterday morning, got the test confirmation back within the same day that that was confirmed for COVID-19. Healthcare agency, and this is one thing that I think is important to note as well, when we have inmates entrusted to our care who have the symptomology consistent with either flu-like symptoms and maybe COVID, we're testing them. We tested 8 individuals, got back negatives, and this was the first positive. And that's not, I think, consistent throughout the public. Not everybody is being tested because some people may be sick and not seeking out the help or testing. I think that's a good summary, Dr. Quick. I'm getting a nod yes. So when the individual exhibited flu-like symptoms, isolated, quarantine is people under observation who may have been contacted who aren't exhibiting symptomology. Isolation is somebody either in our jail or in the public who is exhibiting symptomology, flu-like symptoms, who's being isolated and then tested for COVID-19. So the individual's isolated, tested, got the confirmation, isolation continued for that. We have 6 people who are isolated with flu-like symptoms waiting for test results back. We'll get those back. And the question was, could they have affected somebody else? Yes, it's the same is true in the jail as it is in the community. The difference between the jail and the community is we know where these people are while they're in the jail, and we can isolate through quarantine those that person may have come in contact with, which is not the case in the community, which is why all the recommendations for social distancing and hygiene are so important for us to follow. Michelle, did I answer your question? You're welcome.
Chair Barnes, do you know when that inmate was last in court?
We have the other question that you had, Michelle, that we're going to try to follow up on right now.
Yes, David Suleilas, and I think the question was why we are
cities?
feeling the need to release city data now. So again, David Suleilas, really the ask has come very loud and clear from the community about a desire to have a better understanding of where cases are occurring in Orange County. We have identified a way that we can do that without compromising confidentiality of our individuals who are COVID positive. That said, I think what's important here is to echo back to what Dr. Quick said a few minutes ago, which is that there is community transmission occurring in Orange County. Regardless of where you are in Orange County, we all need to be taking the precautions that the governor has ordered around social distancing, around staying home unless you're an essential worker or going out to get groceries. If you're ill, stay home. If we are not all in on this, it won't be effective. We need to be all in as a community to protect and preserve the health of our community and to particularly protect and preserve the health of the most vulnerable among us, our older adults in our community and those with underlying health conditions. So being all in on social distancing, regardless of the city you live in, is what will be important in the days and weeks to come.
As we talk about a surge possibly coming and hospitals being prepared and the increase of telehealth, do we know a percentage of hospital beds that are open right now and how well prepared we are because less people are going to maybe their doctors or elective procedures and whatnot?
Yes, so most hospitals have canceled elective procedures and most hospitals are trying to prepare, if not all of our hospitals are really trying to prepare for a possible surge that may come. Our goal with social distancing is not to eliminate cases from occurring. Our goal is to spread cases out over time so that our hospitals are able to effectively respond and not be overburdened. You often hear the term flattening the curve, right? We don't want our cases going straight up so that our hospital system becomes completely overburdened. We want to spread it out over time so that the capacity within our healthcare system can effectively respond. So our hospitals are doing their part to prepare as best they can by eliminating whatever volume they can by going to postponing elective surgeries, by moving to telemedicine to reduce the need for folks to come in and to be able to preserve the social distancing. So that is really the goal of our planning and all of the efforts at this time.
We have time for 2 more questions. I'll take one from the phone and then one from the floor. Anybody on the phone?
You can go.
On the phone?
Yeah, there has been reporting that UCI Medical Center, there is a concern about surgeries being done and not enough personal protective equipment such as masks, and masks being reused by physicians at UCI Medical Center. Are you recommending that doctors reuse masks at this point? And what do you know about UCI Medical Center?
So the question, if I can repeat it, is there has been concerns raised about providers at potentially local area hospitals reusing PPE, and what I would like to point out is the CDC has guidelines on management of PPE in times of scarcity, which is exactly now. So we have been referring individuals as in healthcare agencies, individual healthcare providers, first responders, and so forth to that guidance. I would not be able to speak to what's going on at UCI.
One more question from the floor.
Dr. Quick, we've seen some reports that the virus has been around maybe as early as December, November, and some people think that they might have developed an immunity. Can you just talk a little bit about those concerns?
Sure. So we do know that the virus was detected in December in China. So the question is, how long has it been circulating maybe here in Orange County or elsewhere in the United States? Let me give a very brief discussion about how we look for virus in cases. So sort of our gold standard right now in the test that we do in our local public health lab is a test that will detect actual virus particles. So you get a sample from an individual, you can tell if there's actual virus infecting that individual. There's a whole nother class of tests out there that look at people's immunity. So when you get exposed to a virus, your immune system makes certain molecules to fight that off. Various types of those molecules, generally when we have a virus that we have well studied and developed laboratory tests where we have tests that can tell if you have a current infection or a past infection based on those antibodies. Those tests are up and coming right now. The FDA has gotten a whole lot of these tests submitted to them. They're struggling, or not struggling, I'd say they're working through the approval process on that. What we would need sort of as a healthcare agency and a medical community is some guidelines on how to interpret these test results so that we really could get at exactly what you're asking. And yes, there is a desire and a push to be able to look back and see what % of our population may have some immunity to this.
Okay. And that concludes our press conference today. Thank you all for joining us.
David, can you spell your last name?